I'm Dr. Marilyn Stona. I'm the instructor for Nursing 658. You're about to view a lesson developed by CSUSB graduate students. If you have any questions about this video or the content, you can contact me at mstona@csusb.edu, and I'll be happy to answer your questions. We hope you enjoy it. The students have done a lot of work on it.
Describe the difference between a registered nurse and a primary care nurse practitioner. Identify the purpose of a primary care nurse practitioner and how they function in healthcare. Describe the justification of the need for this advanced role. How does your advanced nursing role of primary care nurse practitioner differ from the role of a registered nurse? What do you do that makes your practice advanced?
Well, that's an interesting question because I am working in the same clinic as I did as an RN. And when I worked here as an RN, I functioned as the triage nurse. So I would get phone calls, or I would have students come in and with their complaints, and I would do a full assessment on them. However, as an RN, I really couldn't treat them except for under standard protocol for things like first aid or, insect sting, that kind of thing. My role was pretty limited. And so when I finished my school, then I became an NP, and I was lucky enough to get a job here and stay in the same clinic. And now, of course, I'm able to complete the process of doing the evaluations, coming up with a diagnosis, and a full treatment plan, instead of having to schedule them with another provider. So that's how my role has differed.
Difference. The RN functions as a triage nurse, makes full assessments with limitations. The nurse practitioner completes the nursing process and does the evaluation, diagnosis, and full treatment plan, versus referring to a primary care physician. How do you use evidence-based practice in your care as an APN?
Well, there are some barriers, and I am actually thinking about retirement soon, but I will never fully retire. I've always been a nurse. So I'm looking to go back into hospice care. And as an NP in hospice care, Medicare will reimburse the hospice for me to make a face-to-face visit with the patient when they're coming up for recertification. However, I cannot determine that they are appropriate. And so what I will do is go in and do the full assessment, complete the assessment paperwork, and then that goes to the primary care physician. And he actually has to be, by Medicare rules, the person that makes that decision. I find that a little redundant, and also I feel hospice is very much a nurse-centered practice. It's based on solid nursing principles, and it kind of angers me. I just think that it's not a fair use of the advanced practice nurse.
Evidence-based practice. The clinic providers meet regularly and present literature reviews. Research and concepts that benefit the patients will be incorporated into the clinic. Have you or any colleagues that you know of encountered any barriers to progression as an APN?
I think with healthcare reform that we are going to need more and more and more providers, and the way to have enough providers for all the patients that are going to be coming into practices is to use the advanced practice nurse. I see the field opening wide up. I find it interesting that many of the programs are impacted and people are having a hard time being admitted to a nurse practitioner program. But I think we're going to have to step it up a notch in order to keep up with healthcare.
Healthcare reform. Healthcare reform will create opportunities for advanced practice nurses as providers. Nurse practitioner programs must find solutions to fulfill the need for nurse practitioners.